Monday, November the 15th. We've lost an additional 26 wonderful West Virginians, and I'm going to read those to you right now. Please be respectful. We don't want these people just to be a number, and just think about their families, all their loved ones, and all the great wisdom and all the contribution these great people gave to West Virginia. The 4,611th death is the 92-year-old male from Boone County. The 4,612th death is from Berkeley County. It's a 32-year-old. The 4,613th death is an 86-year-old female from Preston County. The 4,614th death is a 67-year-old male from Grant County. The 4,615th death is a 77-year-old male from Putnam County. The 4,616th death is a 77-year-old female from Wayne County. The 4,617th death is a 67-year-old female from Barber County. The 4,618th death, a 58-year-old male from Kanawha County. The 4,619th death, an 83-year-old female from Lewis County. The 4,620th death, a 53-year-old male from Wayne County. The 4,621st death, a 94-year-old female from Harrison County. The 4,622nd death, a 40-year-old male from Harrison County. The 4,623rd death, a 64-year-old male from Kanawha County. The 4,624th death, a 67-year-old female from Cabell County. The 4,625th death, an 86-year-old male from Putnam County. The 4,626th death is a 64-year-old female from Jackson County. The 4,627th death, an 83-year-old male from Morgan County. The 4,628th death, a 62-year-old female from Kanawha County. The 4,629th death, a 69-year-old female from Putnam County. The 4,630th death, a 65-year-old male from Mercer County. The 4,631st death is an 84-year-old female from Taylor County. The 4,632nd death is a 68-year-old female from Kanawha County. The 4,633rd death, a 30-year-old female. I'm sorry. And forgive me. I just hate it so bad. Good gracious, it's bad enough when we lose one of our elderly or middle-aged people and everything, but this is awful. Our 4,633rd death is a 30-year-old male from Kanawha County. The 4,634th death is a 63-year-old male from Webster County. The 4,635th death, a 57-year-old female from Cabell County. The 4,636th death in West Virginia is a 47-year-old male from Kanawha County. Please remember, reach out. Please do. Active cases are 6,436 cases. That's still down. This is good news right here. The total number of positive cases, 486. Again, maybe that's a delay or whatever over the weekend. We have evidently not tested a lot because our daily positivity rate is at 10.8 or 10.08. The cumulative rate is at 6.15. 272,489 people have recovered. There's 523 people in the hospital, 164 in the ICU units, and 83 are on ventilators. There's 6 green counties in West Virginia, 37 school outbreaks in 16 counties, 588 people. I remind you over and over about if you're 65 and older and you get any symptom at all, you got to get tested, and you got to get tested right then. The antibodies can save your life if you'll get tested. I encourage you about wearing face coverings if you're 65 and older, especially if you go indoors into a crowd of people that especially you don't know, and without any question, if you've got any compromising health conditions whatsoever, lungs, diabetes, whatever it may be, you really need to consider really seriously wearing a face covering. This is the one really that I honestly am really hung up on more than anything. People have got to get their booster shots. That's all there is to it. Pfizer and Moderna, we came out with that early. J&J, Johnson & Johnson followed. If you're 6 months out from having your booster shot, from having your fully vaccinated shot from Pfizer and Moderna, and 2 months out from J&J, you're being very, very, very foolish. Very foolish. If you're 18 and above, you can get that shot, and you need to get that booster shot because your level of protection right now is not much at all. If you're 6 months out, you need that booster shot right now. You know, if you've lost your card in DHHR, if you'll call, we'll get that back. You know, we're starting our round 3 for baby dog and do it for baby dog, trying to get kids, you know, 5 through 11, especially targeting them, but really all children 5 through 17. You know, that's the ones that we're looking for, and you know, so really 5 through 18. You know, and and is it 5 through 17 or 18? 18. Okay, I'm sorry. It is 5 through 18. We're giving away a lot of really great stuff here. You know, we're giving away educational savings funds, you know, and those are we're giving away $10,000 education savings funds for the first week and all the way through for the 4th week. So we're going to give away 100 of them. We're going to give away 400 lifetime hunting and fishing licenses. And we're going to have one really grand prize of education savings fund for a student and a grand prize for a school as well. You know, we're going to have a great big celebration at both those locations and everything, especially, you know, a celebration party at the school that wins. And so with all that, we just want more and more people to sign up and register. But more than anything, we want more and more kids with parental consent and everything to get vaccinated. And we want the parents to totally understand that this is something that's safe as it can possibly be. And with all that, right behind all that and everything, it's protection to keep away, you know, from the potential of side effects that could linger on or whatever it may be if you were infected. And a lot of these kids being right with all the other kids, and, you know, I'm in schools nonstop, going to 2 of them today. And so we just need to really work really hard to get the kids across the finish line. You know, the vaccine eligibility 5 and above now, our young people need to absolutely get with their parents and their grandparents and absolutely get those people vaccinated. From the standpoint of the COVID-19 vaccine info line, it's all up there. You should absolutely understand, again, about testing. Take advantage. It's all free. You know, Frith and Walgreens, we thank them over and over. We got 39 outbreaks in our long-term care facilities, 1 outbreak in our church communities, or really a total of 8 outbreaks in 1 county, and that's in Nicholas County. We have 64 inmate cases and 22 staff cases. That's all good. You know, as far as your flu vaccines are available right now, and you can take them at the same time as your COVID vaccine or your COVID booster. So get that flu vaccine and absolutely get your boosters and get your vaccinations as well. You know, from the rental assistance program that I've told you about, renters and landlords, listen to me. There's real money still here on the table. All you've got to do is contact us, and we'll see that if you qualify, we'll get you those dollars as quickly as we possibly can. The Grand Families Incentive is the deadline is December the 15th. We're on the glide path now that's going to end. It's a $150 voucher for your kids that you're taking care of there. So Grand Families, take care of it. I don't know what's buzzing, but nevertheless, one other thing here, or we got a few other things. Today marks the 51st anniversary of something that was tragic beyond belief in our state, and that's when the plane went down at Marshall. I was there. I was in the dorm at Marshall at that time. An athlete that had been redshirted was in the dorm at that time. all of a sudden, so many friends that were kids on the plane, so many friends that were adults that my family had known forever. A tragedy beyond belief, the worst sports history tragedy that has ever happened in this country. And I want you absolutely to know that those 75 lives that we lost that day, it's just unbelievable. That's just all there is to it to this day. And so, I would please ask all of you to remember Marshall and all those great people that we lost that day in your prayers today. We also lost a great individual, on Saturday in West Virginia, a legend that I got to meet one time, and I'll never forget the size of his hands and the strength in his arms. That was Sam Huff. Sam Huff died Saturday at the age of 87. He was raised in Marion County, and he played at WVU in the mid-1950s. He was drafted in the third round in 1956, played for the New York Giants and then on for the Washington Redskins, and what a stellar career that he had. He ended up in the College Football Hall of Fame and the Pro Football Hall of Fame, and absolutely a great man with strength beyond belief and everything, a great man that we lost at the age of 87. And so, Sam Huff, you'll be a legend. You'll be a legend in this state forevermore. And thank you so much. We lost one of the last Rosies, Rosie the Riveters. Now think about this. These women absolutely stepped up in World War II. We needed them so badly. It was unbelievable. I think there was close to 6 million women that were working every day on our airplanes, our tanks, our ships. They worked as crane operators. They made uniforms, parachutes, and small arm and artillery ammunition. They were the daughters, mothers, wives, and grandmothers, were they not? 6 million of them stepped up, and absolutely, and we lost a great, great, great lady. Her name, Bertha May, her nickname, Buddy Kernet. She was 97 years old and lived in St. Albans. When World War II started, Buddy volunteered to work at the Curtiss Wright airplane factory. She worked as a riveter on the Kitty Hawk aircraft carrier for several years. The women worked in pairs on the Kitty Hawk airplanes, one a riveter, one a bucketer. She worked on one part of the wing assembly. After several years working as a riveter, Buddy joined the Coast Guard. Unbelievable. She's a true West Virginia hero as a Rosie, a veteran, and the widow of a wounded veteran, Earl Kernet. Buddy's son Keith still resides in St. Albans. This is an incredible story about an absolute hero. So, Buddy, we'll miss you. We thank you from the bottom of our hearts, and Kathy and I will surely join in prayer for you, an absolute American hero. Thank you so much. Last thing I've got is Dr. Marsh is not with us today. Today is his birthday, though. So our coronavirus czar, wherever you are, happy birthday. Happy birthday, sir. That's all I got.
All right, thank you, Governor. We'll now go first to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. Just like to highlight some data to reinforce part of what the governor's laid out. Our transmission rate value is now up to 0.95 and headed back towards 1. As we talked last week, we know when that goes above 1, we'll start to see more hospitalizations, ICU and ventilators, and then followed by a surge in, unfortunately, loss of great West Virginians. We're still seeing over 50 people a day admitted to hospitals for COVID, so those numbers continue to stay steady. So again, as the governor points out, not just first doses, but booster doses are significantly important. of the 529 people in the hospital, 28% of those are already vaccinated West Virginians. So we know we've got to get that booster dose. Our ICU and ventilator numbers continue to stay at a steady plateau, and we need to get those numbers back down. We do have ample supply of vaccines available. At the appropriate time, we'll be ordering additional child doses, but plenty of vaccines available. And I would also like to pay my respects to Buddy Cranute and to her family. Buddy was part of the greatest generation that helped win World War II, and a true, as the governor pointed out, a true American hero for her work as a riveter, but also in the Coast Guard. And also to pay respects to the families of those who we lost in the Marshall plane crash. Thank you.
Thank you, sir. Next, we'll go to Secretary Bill Crouch with the DHHR.
Good morning, everyone. Happy birthday, Clay. I want to take a moment to thank the staff of the 2 COVID-19 call lines that we operate here in DHHR. These workers are essential to providing important services to our residents. On March 9th, 2020, Governor Justice announced the establishment of the COVID-19 hotline to address public and medical provider questions and concerns regarding COVID. The hotline is provided through a long-standing emergency preparedness partnership provided between DHHR's Bureau for Public Health and the West Virginia Poison Center. And I said operated within in DHHR. It is a partnership, but I really want to thank Dr. Elizabeth Sharman with the Poison Control Center for taking the lead on this call center and handling 66,000 calls since this started. So Dr. Sharman, thank you for your work and what you're doing for the state of West Virginia. Operators are available 24/7 on that line. That number is 1-800-887-4304. I'll say that one more time, 1-800-887-4304. The second call line rolled out on January 4th, 2021, when vaccinations were being administered in West Virginia. The governor was adamant that we provide public access information and a way for the public to get information in terms of where to get vaccinations. So that COVID-19 hotline assists folks with locating vaccine registration and online contests and many other issues. Since its inception, that call line has handled 222,962 calls. I want to thank John Lopez, a DHHR employee who's been with us for quite a while, doing an outstanding job, and all of his staff. He has a dedicated staff who also do a terrific job. That line operates Monday through Friday from 8 to 6 p.m. and Saturdays from 9 to 5 p.m. You can reach folks on there to assist you in getting an immunization scheduled. That number is 833-734-0965. Thank you.
Thank you, Secretary. Dr. Ayan Amjad, our State Health Officer, is also joining us today and is available for questions. Dr. Marsh, our coronavirus czar, is enjoying his birthday and will rejoin us on Wednesday. We'll now go to questions from members of the media. The first today from Mark Curtis with Nexstar Media.
Good morning, everyone, and happy birthday, Clay Marsh. We won't mention the number, but Clay's only 6 months older than me, so I'll catch up in May. Listen, a serious question here. Several states, in fact, a good number of states have now just said 18 plus, you're eligible for boosters. We have had a process here in this state where you had to be 18 plus, but you had to have a severe underlying medical condition. But I have not heard you mention that caveat the last 2 briefings. Have we essentially opened up the booster shots to everybody 18 plus in West Virginia who now wants to get one of those shots?
Mark, I think that is absolutely the message that I've been trying to get out to people, over and over. We have said, I think you qualify anyway. I think you've already qualified, back, 2 or 3 weeks ago or whenever it was that we started the booster program and everything. But But I'll let Dr. Amjad, come on, and maybe Dr. Amjad can clean that up. But I absolutely believe if you're 18 years of age, you can get your booster shot.
Mark, to simply put, yes. I mean, West Virginia is known to have a lot of residents with high comorbidities, hypertension, obesity, heart disease. So most of our population would qualify. So I would agree that everyone who needs to get their booster shot needs to go out there and get it. As you alluded, I think California, Colorado made that statement in the news media, but everyone in our population who had their first and second dose needs to go out there and get their booster shot right now and not wait for any more news media articles out there like the rest of the country. But anyone who's had their first or second dose, to me, does qualify, especially living in West Virginia right now, and doesn't need to wait for any more statements to come out like that. But they should go out there now and get it.
All right, thank you, Mark. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I was wondering if you could tell us about how many folks have signed up for the first drawing of the third baby dog round, and then when are we going to be announcing the winners? The website still just says the week of the 15th. When are you actually going to be doing that, and do you plan on traveling around to make those announcements again? Thank you.
Yes, we'll be traveling around and make the announcements, that's for sure, Charles. But I think right now we've got 5,000 that have signed up. And that number is just, continuing to ramp up. But later, I think, are we doing that later this week? Yeah, later this week we'll be announcing that, Charles.
Thank you, Charles. Next to Paul Mullen with WCBC.
Morning, Governor. Good morning, everybody, and happy birthday, Dr. Marsh. I'd sing to you, but people would leave. The part about vaccinating the youngest age group now, the 5 to 11s. Have you gotten any blowback on that? And this is probably to Dr. Amjad. Some parents have approached me and said, I'm okay with getting a shot, but I'm not so sure about my kids. I know that's a critical part of the strategy now. And what have you heard back? Thank you.
Well, let me try to answer the first part. Paul, first of all, if I had young children, that were aged 5 through 11, I would do what all of us, I think, should be doing. And that is, I would research, I would get the best knowledge that I could get. And where are you going to get that? You're going to get that from your family doc. You're going to get that from the research of doctors and scientists and everything. And I would make the very best decision I can make. We're always so protective and so concerned about, especially the real young ones. And 5 to 11, I surely understand. You've got a group or segment of parents that have been just beating the door down and trying to run to get their kids vaccinated because they know, at least in their mind, they think and they know what the downside of this dreaded pandemic can really be. And then you've got others that are hesitant and they're standing on the sidelines. And then you've got others that are just saying, I'm not doing it, And so it's a challenge, but I think the challenge is absolutely just one thing and one thing alone. And that is, to try to educate, to try to encourage, to try to give you the knowledge that all of our doctors and all the science community is saying. All the science community is saying that I know of today is these vaccinations are incredibly safe. Absolutely, children can get this and get it awfully easily today. A lot of times they may not even know it, but there can very well be side effects that can carry through. And so with all that known, if my children were 5 to 11 years old, or my grandkids were 5 to 11 years old, I would be an advocate wholeheartedly to have them vaccinated.
All right, thank you, Paul. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking the question, and happy birthday to Dr. Marsh. Governor, some people have come to me and asked me, it feels like that we've moved to this tier of medication, but there's been no official announcement. So in your best guess, having talked to Dr. Amjad, having talked to Dr. Marsh and the experts that you've got working with you, are we moving into an era where every 6 months you can see us getting booster shots for the COVID vaccine? Instead of an annual flu shot, we would get a semi-annual COVID shot, at least for the foreseeable future. Is that where we're going, given that it seems like the effectiveness of the vaccine starts to wane after a half year or so? Thank you, sir.
Well, Kenny, let me defer to Dr. Amjad in just 1 second, but here's what I think we know. I think we know after 2 vaccines, Moderna and Pfizer, and 1 J&J, what we saw happen is we saw 6 months out, we saw a tremendous fall off the cliff as far as the immunities. We also saw that after 4 months, we started a decline in your ability to ward off this disease. But we've also seen this, and we've seen this primarily from Israel, that with the booster, we're seeing a prolonged immunity that stays at a really high level. And so that's why the booster is really, really important. Now, Kenny, in all fairness, can you imagine the number of scientists, the number of doctors, the number of people that are working with all around the world nonstop to try to come up with a pill, a shot that is absolutely iron-proof and will eradicate this thing? Right now, we don't have that, do we, Kenny? And in all honesty, if you were to ask Jim Justice what his feeling is, here's what I would say to you. I would say we're very hopeful that the booster lasts longer than 6 months. And really, at the end of the day, if we've got to take a booster shot every 6 months for a period of time to keep this dreaded killer away from us, it's not that bad a thing. Really and truly, it may very well be that what we've got to do is take a booster shot every 6 months or so for a period of time, but there will be a resolution come. And it will come because our scientists and medical brains are all across the world are working on this night and day. So to give them that time and to give them that bridge, if what we had to do is sign up to take a booster shot every 6 months for a year or 2, it's not that bad a thing. That's all there is to it. And so with that, Kenny, I don't know the answer. All I can do is give you an opinion. And right now, we don't have the end-all, do-all to stop this thing. What we have is a bridge that protects us for a period of time. But Dr. Amjad, if you want to add anything, please feel free to do so.
Yes, Governor. Kenny, the only thing I'll add, and the governor is correct in what he stated, the only things that we do know now is that the booster does offer a longer protection based on the studies that we have, and that perhaps maybe the first and second doses may have been given too close in time. Pfizer was given 21 days, Moderna 28 days. And so the booster now is giving that longer protection in time. But it does remain to be seen whether or not we have to have another booster in 6 months, as the governor stated, or if we'll need it yearly like we do the flu vaccines. But we still don't know yet, but whatever it takes to keep this pandemic or COVID out of our lives would be worth it, as stated. So it just remains to be seen. But that's all we have, the information right now. Everything is changing every day as we see that playing out. But thank you.
All right, thank you, Kenny. Governor, I'll turn it back to you.
Well, I don't really have anything else to say other than the fact that if you're that person that's 6 months out on your booster, or you're that person that's 2 months out on J&J, you got to get this booster shot, and you got to listen to me. It's so important, it's unbelievable, and we can stop this thing together. The more that are vaccinated, the less will die. 26 people today. 26 great West Virginians gone. You don't want to be one of them. If you've already done all, all the work to get vaccinated, you've got to get yourself across the finish line with this booster. So do it. Do it. It's so important. You know, when I looked down at this, the second name I read, the 32-year-old from Berkeley County. And then we went all the way down to the 4,633rd death in West Virginia is a 30-year-old male from Kanawha County. You may not think it, but I spoke at a group earlier this morning, and I said, you can't imagine how tough it is to sit here and read through these people that we've lost. Because I mean it when I tell you that I love you and I care about West Virginians, and I wish to God above that I had the answer that would just stop it. You know, when the terrible flood of 2016 hit, and we were wading mud and doing everything in the world for families and looking for people and everything, we looked forever for a beautiful little 14-year-old girl. We looked for 6 weeks and finally found her miles and miles and miles downstream. You know, so often on the way to wherever it may be, you know, looking for those folks or whatever it may be in that area, I said prayer after prayer after prayer that maybe just some way, somehow we could find her, or I could see where she was. Well, I couldn't do that, but we did find her for that family because it was just tragic beyond belief. And I would say prayer after prayer after prayer that our great people would find a way to come up with something to stop this thing, because it's awful. It's awful sitting here reading these names, and it's way, way worse if you were these families. So please keep them in your prayers, and we're going to stay the course, and we're going to keep trying to get people vaccinated and go get your booster shot, West Virginia. It's really, really important. Thank you so much.